Recent advances in oral medicine and diagnosis. Clinical methods. It has been well established by researchers that virtually all oral cancers are preceded by visible clinical changes in the oral mucosa, usually in the form of white or red patches, which may or may not be associated with additional features of significant discomfort. 8-step examination shown in images. Benefits: identifying white and red the spots that show dysplasia and removing them before they become cancer has proved to be one of the most effective methods for reducing the incidence and mortality of cancer. American Dental Association. Moving on with advances. Chemiluminescence. By definition is the emission of light from a chemical reaction. DISALIGHT, a diagnostic tool for the early detection of oral cancer, is based on the principle of chemiluminescence. The kit contains 1% acetic acid solution, a capsule with an outer shell of flexible plastic and an inner vial of fragile glass, and a retractor. Activation requires breakage of the glass vial by bending the capsule. This permits the chemical products to react and produce a bluish-white light with a wavelength of 430 to 580 nanometers that lasts for around 10 minutes. The procedure involves a 1-minute mouthwash with 1% acetic acid solution. Under this bluish-white chemiluminescent light, normal mucosa absorbs the light and appears blue, whereas the light is reflected by abnormal cells with a higher nucleus, cytoplasm ratio, and by epithelium with excessive keratinization, hyperparakeratinisation, and / or significant inflammatory infiltrate, which appear acetohyte with brighter, marked, and more distinguishable borders. Application of acetic acid on the oral mucosa. Removes debris, disrupts the glycoprotein barrier on surface epithelium and desiccates the mucosa, allowing better penetration of light. Oral mucosal abnormalities are better visualized due to changes in their refractive properties. The blue-white light produced is absorbed by the cells of the normal, whereas reflected by the cells with abnormal nuclei. Dellscope autofluorescence is a phenomenon whereby an extrinsic light source is used to excite endogenous fluorophores such as certain amino acids, metabolic products, and structural proteins. Mucosal abnormalities can alter the absorption and scattering properties of tissue due to changes in tissue architecture and concentrations of fluorophores. Dellscope, LED Medical Diagnostics Incorporated, Barnaby, Canada, utilizes blue light excitation between 400 and 460 nanometers wavelength, 35 to 37, to enhance oral mucosal abnormalities by direct tissue autofluorescence. At these excitation wavelengths, normal oral mucosa is associated with a pale green fluorescence when viewed through a filter, whereas abnormal tissue is associated with a loss of autofluorescence, LAF, and appears dark. Raman spectroscopy, RS, is an optical technique that is both fast and simple. It is one of the most widely used techniques for the non-destructive characterization of molecules and materials. RS probes the vibrational modes of a molecule, which are sensitive to its chemical bonds, and provides a unique fingerprint that enables the identification of chemicals. Optical coherence tomography, a minimally invasive, non-ionizing imaging modality, can generate high-resolution cross-sectional images of near-surface abnormalities in complex tissues. 16. It can be compared to ultrasound imaging conceptually. Lab-on-a-Chip (LOC) technology adapts, miniaturizes, incorporates, and automates analytical laboratory procedures into a single computer, micrototal analysis systems. It includes biotechnology and chemistry capabilities, which have revolutionized healthcare diagnostics. Oral fluid samples are used in the cancer diagnosis and analysis procedure. During dental appointments, a microfluidic kit based on an affordable, disposable microfluidic tape of preloaded, freeze-dried reagents is used in combination with a portable instrument to facilitate early diagnostics and screening. Genetic changes in cancer cells can trigger changes in gene expression patterns that can be observed well before the cancer phenotype manifests. In contrast to normal mucosa, cancer cells have variations that can be used as biomarkers. P53, cyclin D1, and the epidermal growth factor receptor gene are just a few of the candidate genes linked to OSCC tumor formation. Contact endoscopy. It allows for rapid diagnosis and has the unique ability to demonstrate confirmed cellular architecture in vivo. CE can analyze the mucosa's cellular architecture and vascular pattern in real time, and it can be replicated as many times as possible. It can also scan vast areas easily. Advantages. 1. Contact endoscopy is non-invasive, repeatable, fast, and produces results quickly. 2. It will include more data, allowing for a more thorough assessment of larger surface areas. 3. CE can help to prevent tissue injury and cellular architecture damage. 4. It aids in the detection of the biopsy site and the identification of benign and malignant mucosal lesions. Microarrays. Provides hundreds of thousands of genetic details in a shorter period of time. Microarrays are used in conjunction with other screening tools to add additional detail about the tumor specimen by looking at thousands of genes at the same time. Imaging modalities. 2 and 3-dimensional. CBCT. Advanced 3-dimensional imaging modality. Excellent hard tissue identification. Lower the cost when compared to medical CT. Lower the radiation. Less scanning time.